We have been very clear on the reason behind each of our treatments, as well as their mechanism of action. We have talked about the dynamics of the program, its need for an initial comprehensive assessment as the appropriate starting point behind any treatment. Now we will talk about a part that integrates the management of any chronic disease: monitoring. The follow-up program consists of a series of steps that will guide the medical team in the decision-making process to continue treatment. This is a continuous communication between doctor and patient for the purposes of feedback, as well as the series of medical studies required, which will give us a better understanding of the patient's well-being and possible adjustments, modifications, or changes in post-hospital discharge medical management. The oncological field has fully established which tests are considered as the gold standard for follow-up, an adequate measurement of this condition, as well as the time or space required between each measurement. They correspond to a mechanical dose response. That is, the patient is treated with X therapy and wait the established time to see the measurable results. Explaining this dynamic to our patients is of paramount importance, since from the point of view of the patient, any moment could be adequate to perform tests. However, this is not correct, since as we explained, each therapy will require different times to reflect their effect. Because of the aforementioned, it will be crucial to reach the cutoff point where the series of studies necessary to evaluate the response to treatment will be carried out once again. The tests that are required for an optimal and objective follow-up are imaging studies, mainly but not limited exclusively to CT scans, MRIs, and PET scans. Imaging studies allow us to see inside for purposes of locating, measuring, as well as identifying possible causes of the presented problems. Lab work, range of tests taken mainly through the blood sampling to measure different specific markers related to the disease, as well as to have a broad overview about organic function. With these tests, we are coming to an analysis of this function. Previously, with the imaging studies, we saw what was going on inside of the body, but seeing does not tell us the full story. Conducting a proper chemical analysis via the lab work, we will know the whole story about organ function and the real condition of the patient. Hence its great need and close relationship with the rest of required studies. Symptoms. This is where the patient tells us how he feels. During the follow-up calls, we are able to identify the series of symptoms that the patient has been noticing, in which he has been working throughout the treatment, directing our attention towards the changes that the patient is experiencing at that moment, where what is mainly sought is the general improvement of the patient's symptomatology. There will be symptoms that will require prolonged and constant work to bring about change or control over them. The symptoms should be correlated with the test performed. They should be able to integrate and make sense with the rest of findings by the other conducted studies. Physical exam. This is primary, since along with the symptoms, it justifies the proper use of any medical test. This is limited to the physician's ability to identify any findings through sight, touch, or smell. Once again, our objective is the integration of the findings by the exploration with the rest of carried out tests. Subsequent to the individual analysis of each of these forms of measurement, we find the correlation between each of them to achieve the final step, the medical impression. This will be the guideline for taking the next step. Only at this moment we will know with certainty what the therapeutic results were. It is important to let the patient know about the different limitations that we face, even on this day of high-end technology. Despite these technological advances, each of the monitoring tools will have certain limitations as to the results they provide. However, we can rest assured that this technology has shown to be accurate enough and therefore reliable. It is essential to establish that we have no other objective way to reaching a medical impression, if not with the use of these tools, each providing specific information that will allow us as physicians to establish a well-thought-out plan. Communication between doctor and patient throughout this process is vital. It is the only way in which the doctor will obtain a better feedback about their interventions. In turn, it can allow us to prevent certain situations or complications coming at cancer diagnosis. For this reason, providing not only the space for the adequate time to achieve efficient communication as physicians, it allows us to individually evaluate what our patient experiences, feels, and lives. To finish, the follow-up program takes as much responsibility from the doctor as it does from the patient. The doctor will lay down a treatment plan, and it's of the patient's responsibility to follow these instructions to achieve the goals in the time and form. We have already established the need to respect our patients in terms of their decisions and once being fully informed about what is intended. The follow-up is not an exception, where if a patient decides not to perform any of the studies for X or Y reason, he will in no way be denied follow-up care by our medical group. We will do our best to provide a proper medical impression. However, omission of any of these tools may result in a limited view of the real medical state of the patient.